Hi friends, I am Dr. B.V. Rao of Usha Clinic and founder of the websites qmedicaldoubts.blogspot.com and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary for the medical knowledge to general people and for reference to medicals. Today I am going to discuss about the wounds and bites. A wound is a loss of continuity of skin or mucous membrane as a result of injury. Wounds are either incised, lacerated, penetrating, contused, or poisoned. Incised wound. These are the wounds due to injury by a sharp instrument characterized by hemorrhage, with the possibility according to the situation and depth of the injury to the underlying structures. Lacerated wounds. The lacerated wounds, especially war wounds, are particularly prone to infection. In case of recent wounds due to industrial or road accidents, an emergency operation is performed in order to debride the wounds as completely as possible, and every hour's delay adds to the risk of infection becoming established. Debridement. After cleaning the surrounding skin for asepsis, few millimeters of the skin edges of the wound are excised and all damaged tissue and foreign bodies are removed. The dead muscles should be excised meticulously with scissors so that only red bleeding, contractile and healthy muscle is left. Nerves are covered with muscle if possible and carefully preserved. Hemostasis is secured by pressure, hot packs and catgut ligations wherever necessary. If loss of skin is not excessive, closure is the best procedure. Early skin cover is very important, and skin graft over the raw muscle usually takes very well. Sometimes a relaxation incision is wise. The potentially infected wounds may be closed by three ways. Primary suture. In case of clean wound of less than 6 hours delay and with thorough debridement. Delayed primary suture. When there is some doubt of infection even after the debridement or the wound is of 12 to 24 hours delay, the wound is lightly packed with paraffin and dry gauze. After 2 or 3 days, the dressings are removed in the theater and the skin edges are drawn together by a plastic technique, completing the skin cover by a skin graft where necessary. Secondary suture. This is for the late and untreated wounds at about the 6 to 10th day. Due to inflammatory reaction, excision should not be attempted, but a small amount of skin suture may be attempted in certain areas or at the edges of the wound if it is certain that pus will not pocket in the area. Such wounds are treated by wet dressings of saline, saturated sodium sulfate or weak hypochlorite solution till the granulations are healthy and grafting is possible. In all cases, systemic penicillin or appropriate antibiotic is given. Complete rest of the part is important, and a plaster cast may help in case of limbs. It is to be removed for the purpose of delayed primary suture and then replaced for a few weeks till the healing is satisfactory. Penetrating wounds. Penetrating wounds are notorious. A sharp object can penetrate many inches with a mere slit in the skin as the only immediately obvious sign. Impaired movement or loss of sensation indicates the injury to the tendons or nerves, and hemorrhage may be obvious like butcher's thigh. Penetrating wounds of abdomen may be symptomless till there is internal hemorrhage or peritonitis indicates damage to the blood vessels, solid viscera or bowel. So the wound must be explored without delay to discover whether there is intraperitoneal injury. Contused wound. It is usually a result of a road accident dealt with by removing the dirt or foreign bodies and the application of non-adhesive or paraffin gauze dressings. In all cases, appropriate prophylaxis measures against tetanus are to be applied. Bites. Now we will discuss about different bites. Insect bites. The commonest are the bites of wasps and bees. Anthrax is followed by the bite of the horsefly. Anaphylaxis can follow a bee or wasp sting in sensitized people. Vasomotor collapse, coma, and death may occur within 20 minutes, especially if the venom is injected directly into the vein, as on dorsum of hand. Wasps are fond of alcoholic drinks. Picnickers may have glottitis, edema after drinking the uncovered beverages. Pressure on the gland squeezes the poison into the tissues, so the gland and sting should be removed by scraping. Bee venom is acidic and should be neutralized by ammonia, soda, or methylene blue, whereas the venom of wasp is alkaline and requires an acidic as vinegar or lemon juice for neutralization. Antihistamine drugs are given orally and local application is of value to calm the local irritation. Bites of animals. The bites of animals like dog, cat, horse, monkey requires the treatment of the wound if there is a slight suspicion that the animal is suffering from the rabies. The bite is freely excised. The animal is kept under observation for 15 days. If the animal is dead, negri bodies are sought in the brain of the animal. In recent days, prophylactic injections, course of anti-rabies injections are given for any animal bites. Snake bite. In case of snake bites, vomiting and cardiovascular collapse occur in proportion to the amount of the venom injected and the frailty of the patient. First aid measures includes application of tourniquet and within the first few minutes sucking the wound may remove some of the venom. The anti-venom serum obtainable is prepared by immunizing horse with the venom. If it is to be used, antihistamine drugs are to be used along with it. Human bite. A human bite is a very dangerous to life or limb as the wound is contaminated with many types of bacteria including Vincent's organisms from the mouth. Though not a bite, a common type of injury of this kind is an incised wound over the knuckle resulting from a clenched fist, one combatant striking the front teeth of his opponent. The joint is usually penetrated but the tract closes when the fingers are extended. Here the wound must be excised, and if the capsule is penetrated, a portion of the capsule must be included in the debridement. Due to heavy contamination, primary closure of the wound resulting from excision of human bite is not advisable. That's all about the wounds and bites and treatment. And in the next video, I will discuss about some other disease. Thank you.